theory of health, indigenous knowledge systems, health services certification, and the evolution of traditional healthcare in Ghana, with particular attention to how regulatory regimes and sustainable development policies shape traditional medical practice. From growth to market follows the plant with authority. The address sets out the scientific architecture, quality standards, and policy interventions necessary to move a remedy safely from the grove to the clinical shelf, and confronts the central difficulty of the morning, how validation can be achieved without erasing the knowledge that makes validation worth performing. A round of applause, ladies and gentlemen. Let's welcome.
Thank you so much, Miss Belinda, for the generous introduction. Good afternoon. Nananom invited guests, ladies and gentlemen, colleagues in academia and research. I think by now we can all affirm that it is a good thing to be here today. We are hearing and learning so much. And so, introducing my presentation, permit me to say that the title of this seminar in itself, Roots, Remedies, the Hidden Economy of Ghana's Herbal Medicine, is an invitation for all of us to think differently. We are being asked to think of plant medications not only for our remedies, but also think beyond that into the wider systems that give these plants meaning, value, and impact. I think we are also being asked to look beyond the visible parts of the plant, the leaves, the roots, the stems, and think more of the invisible architecture of knowledge, science, enterprise, regulation, community knowledge, confidence, that determine whether these plants are just going to remain local remedies or they become drivers of national development. That is the architecture of abundance. We are being called to think through that. And at this point, I think the question pops up: how can a country like ours, so rich in biodiversity, is still a modest player in the global economy of plant-based products? And this has been alluded to in our keynote address, and our two Nananum who have spoken. I think they have said a lot concerning this. Having said that, I want to agree that Ghana has made remarkable progress in expanding research into plant medicine, regulatory oversight, creating awareness, increasing community awareness. But I still want to emphasize that this question is very, very relevant as we reflect upon this development challenge, which does not confront only Ghana, but other countries in the global south. We all agree from what we have heard, at least if we didn't know before, that traditional medicine continues to play a significant role in healthcare provision worldwide. It's not only in Ghana. We have heard the statistics. Even worldwide, I'm sure it can be said that close to 80% of people, even in the developed world, continue to rely on herbal products because we know they are at least safer. And the World Health Organization recognizes traditional medicine as a major contributor to primary health care, especially in low and middle income countries where access to conventional medicines are quite limited. In Africa, we agree that medicinal plants don't just exist as medicinal commodities, but they also represent culture, biodiversity, community knowledge, livelihoods, and economic opportunity. We've heard so much about this morning. And so at this point I ask, why does plant medicine matter? If we agree that it matters at all, why does it matter? Importantly, we have also heard that even modern medications have their roots in plant medicine. They come from extracts. But at this point, I also want to allude to the fact that all these traditional uses of plants and the knowledge that has been established is not enough to give us what we are looking for from our plant resources in Ghana. And it's at this point that we say science also matters. But if science matters, is science here to replace our indigenous knowledge? I don't think so. Science matters because science validates, improves, and gives value to what we have already. That is why we say that science matters. This slide illustrates a complete innovation pathway for plant medicine. So in this pathway, we are asking, where does the journey start from? We say from the grove to the market. So from the grove, we have our forest. This has been alluded to already. Generations of medical knowledge is created from the grove through observation. And then this knowledge is passed on to our scientists who take our plants to the laboratory. From there, it goes through regulation, quality assurance, before medication reaches the clinics and reaches people who need medicines that are safe and efficacious. And so we see that the whole process starts with that indigenous knowledge. So indigenous knowledge is an enabler. It is not a barrier, as some people make it look like. And this begins by, first of all, choosing the right plant. Choosing the right plant. Many medicinal plants, as we know, belong to different species, but morphologically some of them are very similar. And I was happy when Nana was talking, he talked about this selection, how it is important. If you misidentify a plant, then everything that is going to go after that is not reliable, it is flawed. Because the plants being similar do not have the same chemical activity. And I think our scientists here can allude to that. And so identification is very, very key. And how do we come by the right identification? It is from indigenous knowledge. It is our people who know it. When Prof was giving the keynote address, he mentioned women who are collectors. And that is where everything starts from. If the collectors provide you what is wrong, then every other thing that is going to follow is wrong. And then the evidence that is going to be generated cannot be relied upon. So from the forest with the right identification, our plants go into the lab for botanical authentication. And here our scientists will do a good job by identifying the taxonomy of the plant. From there we have the specimen vouchers. And these vouchers remain permanent and authentic means of identifying which plant is for what in our various laboratories across the world. And so based on this, I want to say that quality begins in the field. Quality cannot be manufactured into materials. The material must be right in the first place. So if the quality of the material is not good, then the product that is going to come out cannot be good. So quality begins long in the field and not in the laboratory. And so here we are talking about good agricultural and collection practices. Prof alluded to the fact that we have lost most of our plant cover over the years. And so now cultivation of medicinal plants is growing currency. And so what do we see? Farmers, collectors, drying, storage. Nana spoke a lot about it. Even how to collect, what time to collect the plant, how to dry the plant, where to keep it, how to dry it, what time of the day to collect it. All these are important. If they are not properly observed, the chemical composition of the active ingredients is going to be completely altered. And so when it comes to quality, we are saying that farmers, collectors, and those who identify the right species, they are all indispensable stakeholders as far as developing our plant medicine is concerned. Then into the lab. From the farm, our plants go into the lab. The labs transform traditional observations into measurable scientific evidence. Researchers first identify the chemical constituents responsible for biological activity. Then they establish marker compounds that enable standardization between production batches. So the lab evaluates, and this includes contamination, microbial quality, heavy metals, pesticide residues, and stability during storage. The objective of all these processes is to ensure reproducibility, because we know that as far as science is concerned, whatever you do should be able to be replicated, to be reproduced by another scientist anywhere across the world. So after establishing all these things, then we know that our plant is good to go. But identifying chemical constituents is only one part of the story. We must establish whether the medicine is safe and efficacious. So when we come here, this is where a chunk of the discussion is. We are talking about safety and efficacy. And so here, science will highlight three very critical processes: preclinical studies, clinical studies, and then evidence generation at the end. Nana did allude to the fact that traditional medicine or herbal medicine is holistic. It takes a lot of factors into consideration. And so these established structures for clinical trials were not meant for herbal medicine. Were not meant for herbal medicines. And even WHO agrees that once we isolate active compounds from the plant, we leave the domain of herbal medicine into pharmaceuticals. But we all agree that all these structures for clinical trials were established for pharmaceuticals. And so when we insist on clinical trials in herbal medication, it's like we are putting square pegs in round holes. And so what are we going to get in the end? And this is where people will begin to say all the things: plant medicine is this, herbal medicine is that, traditional medicine is this. But it's because we are getting it wrong right from the beginning. And so having come thus far, the question we continue to ask is, Ghana and Africa in general, what have we done with our traditional knowledge? What are the structures that we are supposed to do or to establish in order to be able to do our own trials without having to force our standards into standards that were not generated for our medication? How do we achieve this? We have come very far. The argument continues. What is the way forward? Whose responsibility is it? Is it the government? I mean the state, the scientists, the producers, the researchers, whose responsibility is it to ensure that we have the right structures. And that is why in this presentation, I decided to deviate from the normal way of presenting. I decided that I am not going to talk about statistics. I am not going to talk about data. We have had enough of that already. Prof presented a lot on that. But I just want us to look at the issues as they confront us. This is the reality. This is the reality. When we go into research, most of the time, our interest is to finish and publish, gain the popularity, and go. What effect it is having on the industry? What is the effect on the industry? Are we still going to remain where we are, where standards are forced on us? And so when we even talk about good manufacturing practices, people will ask the question, good manufacturing practices, by whose standard? Who is establishing the standards? So how does one system establish standards to be used to try a standard that is all different? And scholars have agreed on this, that traditional medicine is qualitative, while pharmaceuticals are quantitative. So that they are looking at numbers. If you say this thing has efficacy, if you say this plant has activity, how many people, how many cases has it solved? But in traditional medicine, we don't deal with cases. When Nana was talking, he talked about identifying a person, identifying the situation, identifying the herb, and how you can prepare the medication to suit the condition at that particular point in time. So many of our healers will tell us that sometimes someone presents, different people may present the same symptoms, but they would not necessarily use the same herb to solve all the problems for the three different people. So what is the way forward? These are questions I want us to continue to think about. Like I said, I'm not here to give statistics, but to provoke us to think deeper into the issues. All the same, we still have to discuss good manufacturing practices, because if we want our medications to be accepted, then it means we have to try at least to go by some of the established standards. And so when we talk about good manufacturing practices, it involves validated manufacturing processes, complete documentation, quality assurance, contamination control, and batch consistency. Manufacturers will tell you that every medication that is manufactured should be consistent. That is, there shouldn't be a difference between the batches. If you are providing medication for patient A in Ghana, the same medication should work the same way for patient B in, say, Nigeria, or even if it is in Ghana, in Accra, in Kumasi. One batch should not present one thing and another one having some variance. They should be the same. There should be consistency. That is why good manufacturing practices are indispensable. Because we agree that patients receive medicines and not lab experiments. So at the end of the day, whatever we experiment, any evidence that is generated should be able to provide something that is valuable for everyone across time and space. And so this moves us into another critical area as far as our herbal medications are concerned: regulation and market authorization. And when it comes to regulation, I want to dare say that in Ghana we have a problem. We have a problem because manufacturers see regulation as a barrier. But is that what it should be? They see regulation as a barrier because of the bottlenecks. So until these bottlenecks are cleared, healers, producers, manufacturers will continue to see regulation as a barrier. But in natural sense, regulation is supposed to increase confidence. Because if we say that your medication has been well regulated, it means that the quality is assured. And so this will increase confidence in the product. This will also increase confidence for manufacturers because they know they are going to manufacture something that is good. So regulation creates confidence. Regulation creates gives us quality in what we take as our medications. And so in Ghana, we know that the leading institution for regulation is the Food and Drugs Authority. Prof did allude to that in his presentation. He mentioned also the Traditional Medicine Practice Council. And in Ghana, this is here where we have another problem, where we have regulatory oversight being given to different institutions, and instead of reconciling what they expect of us, the burden is put on the poor practitioner. So, for example, the Traditional Medicine Practice Council is supposed to regulate the practitioner and the practice. And then the regulation of production and the product is given to the FDA. But the FDA will tell practitioners that because I am interested in the product, I am also interested in your facility. I am interested in your premises. Because if even you produce the product by good manufacturing standards, where you store it is critical. If you don't store it well, it can still be altered. And you know, FDA does post-market surveillance. And so they will also ask practitioners to register their premises. And so practitioners will ask you, so what am I? I've registered here, I'm also to register here. Instead of the two institutions finding a common ground to reduce the burden on the practitioner, it is left on the practitioner. And so if you don't fulfill this one, you are in trouble with this institution. What do we do? And we know the Traditional and Alternative Medicine Directorate at the Ministry of Health is supposed to provide policy guidelines. It's supposed to provide policy leads. And then I see that all these institutions do not work together. All these institutions are supposed to be collaborating, but I see them working in silos, each one minding their own mandate. Whatever effect it is having on the industry, it is having on the producer, that is their responsibility. So if we have all these challenges, at the end of the day, what do we expect? What do we expect from the poor producers? What are they supposed to do? And a little while ago, I was just talking with Prof that this is a capital-intensive industry. And when Nana spoke, he said that there are three arms reaching for the medicinal plant: the state, the lab, and then the market. Is the traditional healer by himself able to establish all these structures in order to meet the demand or in order to meet regulatory requirements? So this is another thing for us to think through, another thing to think about. Are we actually giving our traditional medications the attention it deserves? Are we looking out to get the benefits that we want from them? Prof gave us the statistics. I don't want to go through that one. The doctor to patient ratio we have in the country, and then the patient to traditional healer ratio we have in the country. I think that one is just 1:200. So if one is more accessible, what are we supposed to do? That is why I said I'm here to provoke us to think deeper about the issues that confront us in this industry and in the country. Whether we like it or not, conventional medications are not easily accessible. Economically and geographically, there is a problem. There is a challenge. So what do we do to the space where we are supposed to get where we need easily? And so as we go ahead, I think I want to ask the most critical question in this presentation. How do we generate rigorous evidence without erasing the knowledge that made validation worth performing? Science and traditional medicine, are they in competition? Are they in competition? Scientific methods, as I stated earlier, they tend to simplify, isolate, and standardize. But traditional medicine reflects holistic relationship among people, plants, culture, and the environment. So what do we see here? These two approaches need not be in conflict. They need to complement each other if we want to go forward. So validation should respect cultural context while satisfying scientific requirements. This balance represents one of the defining challenges for plant medicine research, I think, across Africa and other developing countries. So science and indigenous knowledge, like I said, they are partners, they are not competitors. And so if we are able to partner well, that is where we will be able to produce a stronger science and be able to produce more culturally acceptable medications to be able to meet the healthcare needs of our population. And this brings us to the issue of commercialization. So what do we term as successful commercialization? And one critical point I want to make this afternoon is the fact that ethical commercialization depends on genuine collaboration among all stakeholders. No one should be left out, no one should be left behind. Traditional medicine practitioners, scientists, and here I talk about both natural and social scientists. I'm a social scientist, I'm not a natural scientist, but we all have a stake to play in terms of improving upon our traditional medicine. So the industry, I talk about the manufacturers, I talk about policy makers who are supposed to give us the policy direction if we will go forward or not. But another critical thing we notice when it comes to commercialization is the owners of the knowledge, they are not those in manufacturing. They are not. Because most of the time they do not have the capacity to be able to go into manufacturing. And here I want to emphasize the fact that at the end of the day, we realize that commercialization is not ethical, as I am trying to say. Because at the end of the day, we see that the owners of indigenous knowledge, communities, individuals who have held this knowledge over centuries are alienated from their knowledge. They are stripped of power and control. So they do not even know what happens to their knowledge. So for example, a researcher goes to a community, you take the knowledge from them. The healer gives it to you, and that is the end. They don't know the kind of research that you are going to proceed with the knowledge. They don't know the kind of product that is going to come out from the knowledge. They don't know the clinic where that product is going to go. They don't know who is going to be the end consumer of the knowledge that they gave out. And so they are stripped of power and control, and the power is given to the prescriber. The one who sits in the clinic and prescribes, take this medication. And again, Nana mentioned that we know that this time our country has given policy directive. We are doing this in higher learning institutions. And there's a herbal medicine department at KNUST. So he's asking, they train medical herbalists. Is the medical herbalist more important than the traditional healer? Where did they get the knowledge from? By the end of the day, they get to be the prescribers. The owners of the knowledge do not know how it ends. Communities that have preserved this medical knowledge do not get to enjoy the benefits. So if we are talking about ethical commercialization, we should take our grove into consideration. We should take our collectors, communities who have preserved the knowledge, the scientists who go to take the knowledge, what they do with this, the production, and the end user, that is our community. And at the end of the day, I want to emphasize that it's like a system, and that is why I'm inviting all of us to this system kind of thinking. We should use a system approach, where at the end of the day, benefits should come back to the community where the knowledge was taken from. And so when the benefits come up, we are able to think about the health needs of the people. We think about preservation of our biodiversity, and then it goes back. If our groves are preserved, if our forests are preserved, and where cultivation needs to take place, if they take place very well, and then we can continue to feed the scientific industry to be able to generate the knowledge and the evidence that we need to be able to ensure that we have safe and efficacious plant medicine to take care of our health care needs. And so to conclude, how is success measured? And for me, I want to say that success in this field is not measured in the number of publications we put out there. It's not measured in the data that is generated. It's not measured in the statistics that we establish to be able to say this has done this, this has done that, we have this number. And I say again, that is the reason I decided that we will discuss in this presentation the issues as they confront us. It's not about the generation of statistics. We have done that over and over again. It is time for us to act. And how do we act? And so, success is measured in improved health outcomes. What are we getting as we are commercializing our medicinal plants? What is it giving to us? Are we getting improved health outcomes? And so to get there, we know that scientific evidence feeds into quality and regulation, and this brings us safe and quality products. Safe and quality products make medicines accessible to communities, and then we have better health and well-being. So permit me to say that I have some messages for us to take away from this presentation. And so, first of all, we have to remember that indigenous knowledge matters, because it is the starting point of everything. Without this knowledge, we have nothing. And it is this knowledge that has preserved us right from when we cannot remember. As old as our forests have existed, as old as humanity has existed. And we heard from the statistics Prof gave that in rural, we are in Accra, and we think that you can easily walk into a hospital and access healthcare. People are in places where they haven't even seen a health facility before. What are they depending on? So indigenous knowledge matters. Science creates reproducible evidence. The evidence also matters because we want to improve. We want to improve on our plant medications. We want to validate them. We want to protect them. I didn't even want to go into the discussion of IPs and all that, but we want them protected. And then quality assurance protects our patients. That is where regulation comes in, and market authorization. And then regulation enables responsible commercialization, and then communities can also benefit. Communities must benefit. Thank you so much for your attention.